about. So the first kind of key element, I think, is that it needs to be population-based. So not targeting our services just at those who have high levels of need. It also means then getting on board those people who are already engaging at the whole of population level. And we do have great systems in Australia. We have early childhood, but particularly education services that reach everybody, or nearly everybody. It also needs to be proportionate or progressive. So not everybody needs exactly the same level of support. So we need to be able to, within those population-based platforms, ramp up or ramp down the level of support that any individual child, or more importantly their families, might need. And we know also that even within statutory interventions, that one of the biggest risk factors is those who've already come into the system before. So we kind of need to be able to tailor our services to recognise once someone's come into a service, we actually need to be doing the best job of meeting their needs, not just having a kind of a light touch and kicking them out and then wondering why they kind of recycle and come back again. Often because we've left it way too late to intervene, but also we're not providing the appropriate intensity of service when they do come to our attention. The third P, population-based, proportionate, it also has to be prevention-focused. So to do that, we actually need to know what causes the problem that we're trying to overcome, what causes child maltreatment or poor child wellbeing, and then design a kind of a program logic or a theory of change in order to address that. And I think that's often where we fail. We don't articulate it within our own kind of, service delivery context, and we certainly don't communicate it well to the rest of the population as to why we're doing this thing. Number 4, it needs to be precise. And one of the ways to be precise is to actually base it on data. So if we say that one of the things that's really important for children is to have parents with good parenting skills, are we even measuring that? Do we have a national survey of parenting capacity in Australia? No, we don't. So there's some clear steps that we can take as a nation. And so the kind of actions then I think that come from those kind of 4 P's, population-based, proportionate, prevention-focused and precise, is that we need to then have practice reform, within our own agency. And often we are part of the problem, is that we think we're really good at doing something like teaching parenting skills, and yet we do it in an agency that's got child protection written on the top, which basically says, I've got a problem, come here only if you're a problem parent. That's not really very kind, it's not really very respectful, and it turns people away, it's stigmatising. So we need to take our skill base to where in fact parents are and where the need is. It also needs to be based on partnership. And we need to have prevention platforms and practice frameworks that support those partnerships. And then finally, at the kind of government level, we then need to have that matched with policies. And I think, Kirsty, you were, saying having a fund and having a kind of a national strategy for child wellbeing is the kind of policies that underpin and support that. So there's a lot of P's, but hopefully that's reminded you of what the key elements of a public health approach are. Thank you.